You've already learned that the autonomic nervous system has components, and each component has a chemical messenger associated with it. There's the enteric nervous system, the parasympathetic cholinergic system, sympathetic noradrenergic system, sympathetic adrenergic system, and sympathetic cholinergic system. And you've also learned that autonomic nerves pass through ganglia, so that there are preganglionic and postganglionic autonomic nerves. Now it's time to consider how the components of the autonomic nervous system are distributed in the body. Here's a classic diagram of the arrangement. A reasonable first reaction seeing this sort of diagram is that it's impossibly complex. So let's try to build up from scratch. The central nervous system is arranged like a Tootsie Roll Pop. A Tootsie Roll Pop has a hard candy shell, and inside is a chewy chocolate center. The brain is the lollipop itself, and the stick is the spinal cord. The chocolate center is the brain stem. The spinal cord is divided into sections. There's the section in the neck that's cervical, below that is the thoracolumbar spinal cord, and at the bottom is the sacral spinal cord. The autonomic nerves come from the brain stem as cranial nerves and from the thoracolumbar and sacral spinal cord. Parasympathetic nerves come from the brainstem as cranial nerves and from the sacral part of the spinal cord. Sympathetic nerves, including the nerves to the adrenal gland, come from the thoracolumbar spinal cord. Parasympathetic nerves in the head travel in 3 of the cranial nerves. There's the 3rd, the optic nerve, the 7th, which is the facial nerve, and the 9th, which is the glossopharyngeal nerve. As for all the parasympathetic nerves, the ganglia are located close to or even inside the target organs, and so the postganglionic non-myelinated neurons are short. The neurotransmitter at all the autonomic ganglia is acetylcholine. Acetylcholine binds to nicotinic receptors on the cell bodies of the postganglionic nerves. In the parasympathetic nervous system, acetylcholine is also the chemical messenger released from the postganglionic nerve terminals in the target organs. The receptors in the target organs are muscarinic. The cranial parasympathetic fibers supply the pupils, tear ducts, and salivary glands. Stimulation of the parasympathetic fibers in these nerves causes the pupils to constrict, the lacrimal glands to moisten the eyes, and the salivary glands to secrete watery saliva. The vagus nerve is the 10th cranial nerve. Vagus comes from the Latin word for wandering. As the name suggests, the vagus goes to several places inside the chest, abdomen, and pelvis, and it supplies the heart, lungs, and gastrointestinal tract. Stimulation of the vagus nerve decreases heart rate, increases smooth muscle tone and mucus secretion in the airways, and increases secretion of stomach acid and digestive hormones. Parasympathetic nerves from the bottommost part of the spinal cord, the sacral spinal cord, supply the last segment of the colon, the urinary bladder, and sex organs. Parasympathetic stimulation increases peristalsis in the colon and contraction of the rectum while relaxing the anal sphincter, so that defecation occurs. Parasympathetic stimulation also increases peristalsis in the ureters and activates the detrusor muscle of the urinary bladder while relaxing the urethral sphincter, and so that urination occurs. Third, parasympathetic stimulation promotes filling of the corpora cavernosum and corpus spongiosum of the penis, and thereby can cause penile erection. The sympathetic noradrenergic system consists mainly of thin, slow-conducting, non-myelinated postganglionic nerves. The neurotransmitter mediating the ganglionic transmission is acetylcholine, acting at nicotinic receptors. And the neurotransmitter that's released from the postganglionic nerve terminals is norepinephrine. Stimulation of the sympathetic nervous system in the body as a whole produces many effects. In the head, sympathetic stimulation causes the pupils to dilate. In the salivary glands, sympathetic stimulation evokes secretion of thick, proteinaceous saliva. In the heart, sympathetic stimulation increases the force and the rate of the heartbeat Cardiac conduction is also accelerated. In the airways, smooth muscle cells relax. In the extremities, the hair stands up because of stimulation of arrector pili muscles in the skin. There's also increased sweating, but this is mainly from acetylcholine release from sympathetic cholinergic rather than noradrenergic nerves. In the kidneys, norepinephrine promotes tubular reabsorption of sodium. Probably the most prominent effect of sympathetic noradrenergic stimulation is vasoconstriction, especially of arterioles, which are the main determinant of total peripheral resistance to blood flow in the body. Decreased blood flow to the skin causes pallor. Blood flow is also decreased to the gut, skeletal muscles, and kidneys, and so the blood pressure increases. Blood flow to vital organs is generally preserved. Norepinephrine produces these effects mainly by stimulating alpha adrenoceptors. It's a relatively poor agonist at beta-2 receptors, unlike adrenaline. In the sympathetic adrenergic system, the connection from the spinal cord to the adrenal medullary cells is direct, and so the adrenal medulla receives rapidly conducting myelinated fibers. This fits teleologically with the notion of adrenaline being released in sudden emergencies. Adrenaline is secreted into the bloodstream and distributed widely in the body, and so it's a hormone. Norepinephrine and acetylcholine are neurotransmitters and are released from nerve terminals and act locally. Adrenaline stimulates all types of adrenoceptors, alpha and beta. Because of stimulation of beta-2 adrenoceptors on vascular smooth muscle cells, adrenaline increases blood flow to skeletal muscle. And probably the systemic cardiovascular effect that occurs at the lowest concentration is a fall in total peripheral resistance. At higher concentrations, adrenaline produces well-known stimulation of the heart, increasing both the rate and force of contraction, and constricts blood vessels by stimulating alpha adrenoceptors. Adrenaline causes pallor, relaxes the gut, increases sweating, increases glucose levels, and increases core temperature. Components of the autonomic nervous system can interact. For instance, there are inhibitory muscarinic receptors on sympathetic postganglionic nerves in the heart. Because of this, vagal stimulation decreases the rate and force of cardiac contraction, not only directly by the released acetylcholine acting at muscarinic receptors on the target myocardial cells, but also indirectly by inhibiting norepinephrine release from sympathetic postganglionic nerves. In summary, the components of the autonomic nervous system differ not only in terms of the effector chemicals, but also in terms of their distributions in the body. Although a bit oversimplistic, a general concept is that the parasympathetic and enteric nervous systems are involved with processes that happen at night or behind closed doors, such as digestion, urination, penile erection, buildup of energy stores, and defecation. The sympathetic noradrenergic and cholinergic systems are involved with processes that happen routinely during the day or in the open, such as adjustments in blood flow distribution during standing or exercise, after meal ingestion, or during exposure to altered environmental temperature. The sympathetic adrenergic system is more of an emergency system, reacting to perceived or anticipated threats to overall homeostasis, such as lack of essential fuels, for instance glucose and oxygen, inadequate blood flow to vital organs, and hostile encounters. Well, we've come a long way from a Tootsie Roll Pop.